Hello everyone, I'm going to be doing my final assessment. This is Artem and he will be my volunteer for today. So I'm going to start the assessment. First will be the general. I look at him and I just see that he's comfortable, no distress noted. We look at the skin olive color. I don't see any rash, I don't see any wounds or masses anywhere noted. When I look at the scalp, I don't see any lesions. His head is normal cephalic shape. There's no abnormality, deformity. His hair is even distribution. When I go down the face, same thing. I see facial symmetry. I don't see any masses, any lesions anywhere. I'm going down. Any pain? Any pain? Sinuses are fine. And if we keep going, you're gonna go open your up and down your mouth. The TMJ, no pain?
No pain.
And then we're gonna go to the mastoid process. Any pain?
No.
Alrighty. We're gonna go from there into the nose. Alrighty. We see that it's patent. Septum is even. The turbinates are nice and pink and shiny. We're gonna go after that into the mouth. You're gonna stick out your tongue. Go pick it up. I don't see any masses, any lesions, any ulcers. When I look at the buccal mucosa, same thing, it's nice and pink. I don't see any lesions. Say ah.
Ah.
When I go down, I see the uvula. It's in the center. It goes up when he says ah. I look at the throat, it looks well. And when I look at the teeth, I don't see any. They're all intact, everything looks fine. I don't see any problems in the teeth area. And then we're gonna do, now the next part is gonna be the cranial nerves. So what we're gonna do, test this. First, you're gonna close your eyes. I'm gonna go, tell me when you feel touching to your face, and this is nerve number 9, nerve number 5, trigeminal. Do you feel anything? Tell me when you do.
Oh, yes. Yes.
All right, now you can smile for me. Raise your eyebrows. That is nerve number 7, the facial nerve, and that's intact. After that, what you're gonna do for me is swallow. That's nerve number 9. That's the glossopharyngeal. Next, what you're gonna do is say A-E-I-O-U.
A-E-I-O-U.
That is cranial nerve number 9, the vagus. And after that, what you're gonna do is stick out your tongue for me. And then that is the hypoglossal nerve number 12. And what you're going to do is shrug your shoulders for me. And that is cranial nerve number 11, the spinal accessory. After that, what we're going to do is look at the eyes. So what we see, right, what we look at the eyes, and we're going to see that right now that the eyelids look fine. I don't see any discharge. There's no lesions. When I look at the sclera, it's nice and white. When I look at the conjunctiva, it's nice and pink. I don't see any inflammation, any redness, any oozing out from there. Now what I'm going to do is look at the optic nerve number 2, and we're going to see that, make sure that the pupils are equal, that they're round, which they are, and that they react to light. And this one reacted, same thing. And then the last part would be the accommodation. You're going to take my finger and follow through, and we see as we get closer that the pupils accommodate and get more constricted. The next part will be the eye exam with a ophthalmoscope. And what we're going to be looking now is inside. You're going to look straight. And we're going to start and make sure that there's a red reflex. And I see the red reflex. And then what we're going to do is go look inside the actual retina. And when we go in the retina, what we see is there's no vascular disease. The macula is nice and orange. And then the optic disc is round and distinct round. Sorry about that. And after that, what we're gonna do is now look at the ears. And we're gonna be testing, before we do that, we're gonna look at cranial nerve number 3, which is the ocular motor. Then we're gonna do 4, which is the abducens, and then number 6, the trochlear, and then the abducens, and that's going to be the coordination. So you're going to follow the same, my finger. So we'll start in the center, and we're going to go up, 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 down, down in the center, down the right. So we see that nerve, all 3 nerves are intact. And then the last one is going to be nerve number 8, and then that's the acoustics, and that's going to be going into the ears. So what I'm going to do is I'm going to whisper something to you from the side, and you're going to let me know what I say.
A. B.
All right, and now we'll look at the ear. All right, and what we're going to do is pull up, and we're going to look inside the canal. We see that there's no discharge. It's a nice pink. And then we're going to look at the tympanic membrane, and it's a nice pearly gray. I don't see any perforation. The next, what we're going to do is look at the neck. So we're going to see the trachea is symmetrical. It's central in the center. We don't see any deviation. What I'm going to do next is just, you're going to take a swallow for me. And then I could feel the thyroid. It's very minor. We could feel a little bit of thyroid. After that, the next part, what we're going to do is going to listen to your carotid. And then just make sure that there's no throat. And we don't hear any throat. After that, what we're going to do is I'm going to have you, what we're going to do is listen to your lungs after this. So what we're going to do is you're going to turn sideways for me. I'm going to do your posterior first. There you go. So we're going to start by auscultation. So take a deep breath in and out for me. Take a deep breath in and out. Take a deep breath in and out. Take a deep breath in and out. Again. And one more time. After this, what we're going to do is percuss it. After that, what we're going to do is the tactile parameters. So I'm going to put my fingers, and you're just going to say 99.
99. 99. 99.
Move up a little bit. Thank you. Again.
99.
Alrighty. And then what we're going to do is the bronchophony. And you're going to do the same thing, 99.
99. 99. 99. 99. 99. 99.
All right. And now what we're going to do is going to go to the front and to the anterior. Alrighty. Same thing. Take a deep
99.
breath in. Sorry, in and out. Again. Again. And now we're going to do the same thing, the tactile parameters. So you're going to say 99.
99. 99. 99. 99.
Alright, and after this, what we're going to do is listen to your heart. So we'll start with the aortic, which is going to be on the left, and it's going to be second intercostal space. Take a deep, just listen to it. And it's going to be S1, S2. And then we're going to do the same thing, S1, S2, no thrill. Next, what we're going to do is the pulmonic, which is going to be on the left side, second intercostal space. S1, S2. S1, S2, no thrill. And then we're gonna go to the third, which is Earp's place. S1, S2. S1, S2, no thrill. No Brewitt. And after that we're gonna go the fourth, which is the tricuspid. S1, S2, no Brewitt. And then S1, S2, no Brewitt, no thrill. And then the last one's gonna be the mitral, which is in the center on the fifth intercostal space. And it's S1, S2, no Brewitt, no thrill. S1, S2, no Brewitt, no thrill. And now what I'm gonna have you do is lay down for me, and we're gonna do the TMI, the PMI. I mean. What you're gonna do is exactly in your left side. You're gonna lay on the left side. You're gonna lay on your left. Pick up your arm a bit, and what we will do is the same thing. Go mid-clavicular, go the fifth intercostal space, and that would be the PMI right there. Now what we're gonna do now is you can lay on your back. We're gonna do your abdomen. So I'm just gonna lift up your shirt a little bit. I'm just gonna just assess your abdomen. So I look at it and I don't see any lesions. I don't see any wounds. The skin looks intact. I don't see any masses. So what we're gonna do first after this will be the auscultation, and we'll start in the right lower quadrant. And what we hear is the normal hypoactive, normal active valve. And after this, we're gonna do percussive, same thing, 2 spots in every single quadrant. And after that, what we're gonna do next would be, after we have the auscultation inspection, then what we're gonna do is palpation, and we're gonna start with light, and then we'll go deep into doing the same order with the right lower quadrant and go around. Any pain?
No.
Any pain?
No.
Any pain?
No.
Any pain?
No.
And now we're gonna do a deeper one. Any pain?
No.
Any pain?
No.
Any pain?
No.
Any pain?
No.
And what I'm gonna do also is auscultate for the aortic, and make sure that there's no thrill. And then right by the umbilicus. And I don't hear either, just normal. After that, what we're gonna do is for the palpate for the liver, which is gonna be in the in the right upper quadrant. And what you're gonna do is take a deep breath, and I'm gonna press in, and I don't feel any big masses. And then what we're gonna do is the spleen, and then that's on the left upper quadrant. And same thing, we're gonna go right underneath. So take a deep breath, and I don't feel anything when he takes a deep breath. After that, we would do the kidney, and that requires both hands. So we're gonna put one under here, and you're gonna take a deep breath. And when he takes a deep breath, then I'm gonna press down, and that's when I would see if I feel a mass. Okay, take a deep breath, and he exhales out. I don't feel anything over there. So kidneys feel fine, and we do the other side. What you're gonna do, sit up for me, and I'm gonna do if there's CVA tenderness. You're just gonna turn slightly a little bit for me. There you go. And we're gonna go for the 12th intercostal space. Put our palm, and then with the fist, we're just gonna hit it one time. You're gonna sit up for me a little bit, and let me know if you have any pain.
No.
And we see there's no tenderness over there. The next part is gonna be then, what you're gonna do is stand up for me, and you're just gonna walk, and you'll walk straight forward and walk back, and we see that the gait is intact. He's walking straight and even. Everything is symmetrical for that. The next part is what you're gonna stand there, put your hands against your body, your feet straight together, and close your eyes. So we're doing Romberg's, and we see that he's passing that. Did well with that. Next thing you're gonna do is sit down for me. gonna do, first will be the biceps and then the triceps. So you're gonna hold your hand out for me like that. And okay, you're gonna relax it. You're gonna hit it right in here. And what we do is contraction here, a little bit of flexion. And we're gonna take the hand. We'll do the tricep and the same thing. And it's gonna be a little bit of contraction, flexion here. And then what we're gonna do is the patellar. So you're gonna hold your knee out for me and go. And same thing, it'll be a little bit of flexion and contraction from the thing. Next, what we're gonna do is look at the vascular. So I'm gonna look at his skin. I'm gonna see if there's capillary refill. I see it's less than 2 seconds. I'm gonna feel the turgor of the skin. I see there's no dehydration, it's doing well. I look at the feet and I don't see any edema. I don't see any edema in the hands. And then after this, I'm gonna do is palpate for the pulses of the artery. So we're gonna start with the carotid. And they're bounding good at +2. Next will be the brachial. Same thing at 2. We'll go to the radial. +2. And then what you're gonna do is lift up your foot for me. Just put it here. And we're gonna go to the pedis, dorsal pedis. And we see that one's also +2. And then we're gonna do the posterior tibial. And I feel +2 over there also as well. And the last part we're gonna do is you could probably just sit on the couch for me. It'll probably be easier this way. So we're just gonna be doing the, first I'll have you look forward, look straight for me, and bend forward. I'm gonna check if you have scoliosis. And we see the spine is even, symmetrical. I don't see any curvature anywhere. So that's good. And next thing we're gonna do is of the upper body, and we're gonna check your strength. So what you're gonna do is to sit there and turn your neck, go to the right, to the left, go up and down. And now same with your arms, put them out, put them to the side. Now hold them straight in front of you and try to pick them up. Okay, good. And now I'm gonna try to press down and you pick them up against it. So we see that it's a +5 for strength for that. What you're gonna do is sit sideways for me. I'm just gonna do one last thing for your neck. So what you're gonna do is I'm gonna try to turn your head this way and you just go against the resistance, okay? You're gonna turn this way and I'm gonna try to press again. Alright, good, and we see that strength, and the same thing this way. So we see it's a +5 and a +5. Next, what you're gonna do is your elbow, so you're gonna flex with your arms, go up, go down, go sideways, like scissors. And now I'm gonna try to press down, and you pick them up. Okay, good, and now turn it around and try to press down, and I'm gonna pick up, good. Same with your wrist, go up, go down, go to the sides. And I'm gonna try the same thing. I'm gonna press on your wrist, try to pick up, and turn it around. And there we go. It's a +5 for both of those. You're gonna stand up for me, the hip, turn side to side. Now laterally go this side to side, and do a rotation. Okay, good. Now what you're gonna do is lay down for me. Okay. Now what you're gonna do for your hips, you're gonna lift up both legs, put them down, turn around and lift up one leg at a time the same way. So lay in your stomach, and lift up this leg, and lift up this leg. Okay, now you can turn back. And you could probably actually, I think for this one, probably sit up, it'll probably be easier. Sorry. Now what you're gonna do is lift your knees forward for me. Push them forward. There you go. And now I'm gonna try to do resistance, so you can put them straight, and I'm gonna try to press and you push against me. There we go, so we see that's good. You're gonna lay back one more time, and we'll just do your ankles now. So what you're gonna do is lift up your feet forward, put them down, and I'm gonna try to press and try to go against me, and vice versa. Good. So we see that the musculoskeletal is all intact, and that is it. Thank you. Have a good day.